way back in February 2020, imagine OHTs were 3 months old from the first announcement that was made in November. We were talking about logic models for OHTs, early forms of evaluating these programs. We came back again in round measures in November of 2020, and this is what our invitations used to look like in those days. We've definitely evolved and emerged since then, but these are still quite valuable, and resources I'm going to highlight that we put out then, I think, are still being used. And in fact, we are still using the resources that we designed back in 2020 for some of this work now. The next slide, just what is a logic model? And this is the same as what we originally suggested. So thinking about understanding, to lumber the comments that are going in there, what is it the program does? That's the activities. And what are the resources that you're putting into? What are the people? What are the technologies? What are the new tools that we're putting in place? Those are the resources. And then what are we doing with them? That's the planned work, the activities. And then coming across to what are the outputs that you can count to know that you're actually doing those things and you're reaching the people. This is like the number of people that might be in your program, the number of case conferences, interprofessional team meetings, those types of things that you can count. But really, what are the outcomes? And we're working a lot with a number of the leading projects right now in one aspect of the OHT evaluation, where we're trying to understand and delve into what are the common outcomes that we can think about across these different programs. And then finally, the impact is more of a multi-year, longer-term impact that can be on the health system for better organization. It can be on people's health outcomes and goals, but a longer-term impact of the program and how things actually look differently as a result. So that's kind of understanding the program. The logic models are really about a communication tool about what it is that you're trying to do, the goal of the program out there on the impact side. And then, how would we know if we're working towards that? Are we doing the right things? And are we actually achieving some of the outcomes that we're intending to do? Out of here, once we have laid out, what it is that you're doing, and, we have a resource there at the bottom you can follow up on later, right off the OHT evaluation space, then you need to start thinking about what the measures are that you're going to do. In all of our work, we've been taking a quadruple aim, but also with equity in each quadrant to measurement. So thinking about patient experience, health outcomes, cost, and provider experience. And HSPN has been layering on lots of measurement around all of these, which is shown on this slide, thinking about what's meaningful to people. What are the indicators that we're looking at through our spider diagrams and league tables? What are the costs looking like for total costs and monitoring that? And then also understanding about provider experience and monitoring and supporting that within a number of the OHTs. And we've been doing that work at a local level. So that's the measurement side. And you can actually think about tying your measures in to your logic model when you think about each element of your logic model. What are the resources, activities, outputs? What's the measure? How are you measuring that? Where will you get the data? What's your approach to capturing it? And then how often are you going to be reporting it? Again, this is another table as you start to think around operationalizing your logic model that's available in PDF and document form on our website, that you can use this table to start to fill in that you're doing things well in terms of your evaluation. So that's what we've talked about before in supporting early days of evaluation. You'll see aspects of this in all three presentations. The last point I just want to pause on for a moment is thinking about how do we use data and how do we think about the type of evaluation and the design that we're using a little bit. And I'm just going to kind of talk about three different approaches. One is like a case study, which is just understanding what it is that you're doing, and being able to describe and tell that story well, and what are the successes and challenges. And this is an approach that we use for a lot of our work. And you can be thinking about describing that from within your own programs. You may want to be actually seeing if things are changing over time. And at that point, you really need to have this kind of before and after, measuring twice and seeing if there's a difference and how things have changed. That could be on a qualitative, but also a quantitative approach to think about how things have changed. And very often that will be your capability of that before and after. Where external parties come in or more rigorous designs can be helpful is moving into more quasi-experimental design. And that is to say, either by adding a comparison group, which says like, what happens if we hadn't done this? or what happens to the people who didn't receive this program, or time series models. And I just want to give you a clear example that some people here may remember on why this can actually be important to have a comparator. So if we go to the next slide, we'll see here, this was work we were doing at HealthLinks, which was a precursor to Ontario Health Teams. It was actually also designed by as a Ministry of Health initiative supported. And this was what we were seeing in HealthLinks, in those people who are enrolled in HealthLinks across Ontario. So the gold line at the top are the people that were enrolled in HealthLinks programs. And this was their monthly cost. We could do this in a lot of different measures, but total system cost is the one I have here, comprehensive of all care. And then we have a comparator group that we were able to use matching with kind of a sophisticated statistical approach called propensity matching. And we looked at these, so we found two groups of people and what was happening with their costs prior to starting the intervention. And then in the usual pre and post, the next slide shows what happened to the enrollees after being enrolled in the HealthLinks program. And this is what most programs were able to show, which is that, you know, costs were going up for these people. They were becoming very difficult, very costly, and they're encountering the health system a lot. And then we gave them HealthLinks and costs came down. And that is a very good success story for the people that were enrolled in the program. But the second line here now is seeing what happened to the people not enrolled in HealthLinks. And it turns out that they also had a reduction in their costs after that period of escalation. And in fact, that reduction was a little bit stronger than the people in HealthLinks. So comparator actually costs declined more than the enrollees. And one of the rationales of the program was to improve coordination and reduce total system cost. And by having the comparator, we were able to see that while HealthLinks clients' care was reduced, it also happened to people who were not receiving care. It's a phenomenon we call regression to the mean, but it's emphasizing the importance that you need to do pre and post, but sometimes we really also need to have comparators to understand, and that's where the more rigorous designs come in. I just wanted to drop that in. We have a community of practice where we can have more informal discussions, evaluation performance improvement for Ontario Health Teams. It's people working on evaluation for performance improvement and supporting that work in OHTs, and it's a chance to share experience in a meeting format, not on a big webinar with, you know, hundreds of people. It's a smaller format, although they do get 100 registrants, I think, often. But it's smaller, it's group, it's more formative, and a whole number of range of topics that have been covered. The recent topics that have been up on the next slide are, you know, for example, assessing learning health system capabilities. We talked about a self-assessment tool. There was an analyst cafe last month, just sharing experiences and challenges. And in December, there's going to be a focus on evaluating digital and virtual care solutions. These are held on the second Tuesday of the month, so just 2 weeks before this webinar. And here's how you sign up. And Kaylee, who leads these, is dropping the links into the chat for you around the Ontario Health Team shared space. This is on the hosted between RISE and Quorum from Ontario Health. And find the collaboratives page and look for evaluation performance improvement. It is, no joke, the hottest collaborative team out there outside of the QIPs, which are a mandated initiative. This is the hottest commodity, the most active collaborative. Welcome you all to join us on our monthly events.